Welcome back to the channel. Today, we're discussing two commonly misunderstood mental health conditions: bipolar affective disorder and borderline personality disorder. While they share some similarities, they are distinct disorders that require different treatment approaches. Misdiagnosis can lead to ineffective treatment. So let's break it down and clarify the key differences. If you or someone you know is struggling, always seek professional help for an accurate diagnosis and the right support. Understanding the basics. First, let's define both disorders. Bipolar affective disorder, BPAD, is a mood disorder characterized by extreme shifts in mood, energy, and activity levels. It includes periods of mania or hypomania and depressive episodes. Borderline personality disorder, BPD, is a personality disorder that affects a person's emotional regulation, sense of self, and relationships. It often includes intense emotional reactions, fear of abandonment, and unstable relationships. The main distinction here is that bipolar is a mood disorder, whereas BPD is a personality disorder. This means they impact the brain and behavior differently and require different approaches to treatment. Mood swings. Bipolar versus BPD. Mood instability is a common feature of both disorders, but the patterns are very different. In bipolar disorder, mood changes happen in episodes that can last for days, weeks, or even months. Mania includes elevated mood, increased energy, impulsive decisions, and sometimes psychosis. Depression involves deep sadness, lack of energy, and loss of interest in life. In BPD, mood swings are often short-lived, sometimes lasting only a few hours. Emotions can shift rapidly in response to interpersonal interactions or perceived rejection. While both involve intense emotions, BPD mood swings are more reactive and situational, while bipolar episodes are more cyclical and persistent. Relationships and interpersonal struggles are one of the defining features of BPD. The difficulty in forming and maintaining stable relationships. People with BPD often experience an intense fear of abandonment, idealizing, then devaluing loved ones, emotional outbursts, and impulsivity. That's in contrast. People with bipolar disorder may struggle with relationships due to the extreme highs and lows of their mood episodes. But their core sense of identity and attachment patterns are not as unstable as in BPD. However, during manic phases, impulsive behavior and risk-taking can also create relationship challenges. Both conditions carry significant risks if left untreated. In bipolar disorder, there is risk of self-harm, suicide, reckless spending, substance abuse, and psychosis during manic episodes. In BPD, there are high rates of self-harm, suicidal thoughts or attempts, impulsivity leading to risky behaviors, and difficulties maintaining employment and relationships. Because of these risks, diagnostic clarification and appropriate treatment are critical. If you or a loved one are experiencing symptoms, please seek medical advice as soon as possible. Although both conditions affect emotional regulation, treatment approaches differ. Bipolar disorder is often treated with medications such as mood stabilizers, antipsychotics, and sometimes antidepressants, alongside therapy like cognitive behavioral therapy, CBT, or psychoeducation. BPD treatment focuses on therapy, particularly dialectical behavior therapy, DBT, which helps with emotional regulation, distress tolerance, and interpersonal effectiveness. Unlike bipolar disorder, medication is not the primary treatment for BPD, though it may be used to manage specific symptoms. Both conditions benefit from lifestyle changes, such as maintaining a regular routine, avoiding substance use, and engaging in self-care practices. Importance of professional diagnosis. Because of overlapping symptoms, bipolar disorder and BPD are sometimes confused. However, an accurate diagnosis is crucial because mistreatment can lead to ineffective or even harmful interventions. If you suspect you have symptoms of either disorder, seeing a doctor for a referral to mental health services or a psychiatrist is the best course of action. Understanding the difference between bipolar disorder and borderline personality disorder can help reduce stigma and ensure that people receive the right support. If this video was helpful, Please like, subscribe, and share it with someone who might benefit. And remember, seeking professional help is the first step to managing mental health effectively. Thanks for watching, and I'll see you in the next video.